I'm Friedhelm Sandbrink, a neurologist and pain physician practicing at the Washington, D.C. VA Medical Center, and the executive director for the National Pain Management, Opioid Safety, and Prescription Drug Monitoring Program in the Veterans Health Administration. This year's CMS Quality Conference is titled Building Resilient Communities. And for us in the Department of Veterans Affairs, our work is centered on supporting veterans, their families, and caregivers nationwide, and in particular as we provide them with healthcare through the Veterans Health Administration. About 1 out of 3 veterans has a chronic pain condition, and chronic severe pain is about 40% more common in veterans than the general US population. Veterans with chronic pain are particularly vulnerable to suffering from reduced quality of life, whether it is from their musculoskeletal pain, the most common pain category in veterans returning from combat and deployments, or headache conditions such as associated with traumatic brain injury or other pain issues. The majority of pain care happens within primary care, and we are expanding access to pain therapy approaches within our patient-aligned care teams, the medical home for veterans in primary care, and in VHA specialty care. We are particularly concerned about overdoses and suicides in the veteran population. And from 2010 to 2019, overdoses increased by 50%. And as in the general population, there was a further increase during the COVID crisis. We are striving to reduce, actually eliminate suicides in veterans completely. Veterans with chronic pain often have mental health comorbidities such as depression, anxiety, or post-traumatic stress disorder. And they may be particularly high risk for substance misuse and overdoses. And we seek to support veterans with chronic pain conditions, their families and caregivers, and the primary care providers who take care of them by expanding access to pain treatment approaches. In particular, we are building interdisciplinary pain teams at every one of our more than 140 VHA facilities in alignment with the Comprehensive Addiction and Recovery Act from 2016. We seek to provide access to pain care, not only with medications and interventional procedures, but also behavioral pain care and integrative modalities, such as acupuncture and chiropractic manipulation. We are providing resources for building pain rehabilitation teams that deliver coordinated care between pain psychologists and physical therapists. And we have 20 CARF-accredited comprehensive pain rehabilitation programs with more to come. In addition to VHA's stepped care model for pain, we continue to expand access to substance use disorder treatment through our stepped care model for opioid use disorder. For instance, we integrate care for opioid use disorder into our pain management teams. We plan to continue to expand our telehealth efforts in order to reach veterans wherever they are, through telepain care provided by medical center teams, regionally based clinical resource hubs, and national programs such as our Pain Empowerment Anywhere comprehensive pain rehabilitation team at the Tampa VA that provides virtual pain rehabilitation to veterans accessible nationwide. And as we expand those services, we have taken a whole health approach that supports the whole person. Dashboards help us to identify the persons at highest risk. VA just recently held a state-of-the-art research conference about measuring what matters most, thus reflecting our desire to support our veterans and our clinicians with a better understanding what is most important for our veterans and how we can best support them. And we are grateful to our partners, the Department of Defense and the Department of Health and Human Services, and other federal agencies and non-federal entities, as we continue on our journey to support veterans with healthcare that is patient-centered, individualized, and coordinated between the patient, primary care, and specialty care. Thank you.